Hi, I'm Ron Lang, CEO of CalCPA's Group Insurance Trust. This is part of a series of short videos in which we'll explain some of the key elements of the Affordable Care Act and most importantly how it may affect you, your firm, and your customers. First step in navigating ACA is to determine which set of rules to play under. For the most part, regulations are determined by size. So whether for yourself, your firm, or in consulting a client, sole proprietors are classified as individuals under ACA. They have no W-2 employees. If you have W-2 employees, even if they are currently waiving coverage, you are not a sole proprietor, you are a group. Small employers have between 2 and 49 employees. This rises to 100 in 2016. Large employers have over 50 full-time equivalent employees. Most CPAs are either sole proprietors or in a small group. This video covers sole practitioners. Small groups and large groups are covered in separate videos. So where do we start? Here's a timeline of where we've been and where this is all going. To date, ACA has extended dependent coverage to 26-year-olds, eliminated lifetime maximums, and mandated preventative services. But the most significant provisions become effective January 1st, 2014. The individual mandate, play or pay, the exchanges, eliminating pre-existing condition restrictions, mandated benefits and plan designs, deductible out-of-pocket costs and rate restrictions, and numerous taxes and penalties on individuals, employers, and health plans, all hit at once next January. This means big changes for sole proprietors. This will be based on your age and address, not on prior medical history. And policies are guarantee issue with no pre-existing condition limitations. This means if you are the same age as your neighbor, and one of you is healthy and the other has a long history of expensive medical costs, you can both receive the same coverage at the same premium rate. Everyone is subject to what is known as the individual mandate. If you do not have health insurance in 2014, you will pay a tax on your individual return. The mandate is fairly straightforward. Obtain health coverage or pay the tax. ACA provides subsidies for lower income folks, which we'll cover in a minute. Here's the tax schedule for not complying with the individual mandate. The penalty is the greater of a flat dollar amount per individual or a percentage of the individual's taxable income. As of this recording, the IRS has not published the threshold to calculate the tax, but it's estimated to be somewhere around $10,000 for 2014. Therefore, most CPAs and the population in general will use the percentage method. For any dependent under age 18, the penalty is half of the individual amount. In many instances, the tax is considerably less than what insurance premiums will cost, especially in the early years. Subsidies are available for individuals and families making less than 400% of the federal poverty level, as shown in this schedule. If you qualify for a subsidy, you must make the premium payments shown on this schedule. The subsidy is paid directly to the insurance companies by the government. If you qualify for a subsidy, you must purchase through Covered California. What is Covered California? It's the name of California's health insurance exchange. What's an exchange? It's nothing more than a marketplace, a place to comparison shop for health insurance plans. We'll be covering Covered California, no pun intended, in a future video in this series. We've given a quick run-through of the taxes and subsidies imposed by the new law, but given the thresholds for subsidies and tax credits, we believe very few CPAs and CPA firms will qualify. So let's focus on the coverage options available to solo practitioners who do not qualify for subsidies. You have three sources for obtaining coverage. CalCPA's Group Insurance Trust. We've been insuring CPAs for over 50 years. This is a unique CalCPA membership benefit, especially important for 2014 and beyond. We offer a number of PPO and HSA plans. HSA plans are very popular with CPAs. Number two, the regular commercial market. Blue Shield, Cigna, Kaiser will all provide policies to anyone that applies. Number three, Covered California will have a selection of plans from Blue Shield, Kaiser, Health Net, Anthem, and other small regional carriers. Big names like United Healthcare, Aetna, Cigna are not offering plans through the exchange. As I mentioned above, with very few CPAs qualifying for subsidies, the Trust has decided not to offer plans through the exchange. It will be a mixed bag going into 2014. Many sole proprietors who currently have coverage or have coverage through a spouse's group plan may see significant premium increases, while others may experience more moderate rate increases. When shopping and evaluating plans, here are some tips. Overall, don't shop by the lowest price alone. First, evaluate the provider network. Look for your doctors and hospitals or docs and facilities in your area. Many low-price plans are using what are called skinny networks, and many plans do not have statewide coverage. Just because the plan is Blue Shield, it does not mean it includes their entire panel of doctors. For example, Covered California plans with limited networks in Los Angeles do not include UCLA and Cedars-Sinai medical centers, except for Anthem, who does include UCLA. I'll mention here that CalCPA ProtectPlus utilizes the Anthem Blue Cross full networks of docs and hospitals, so our members have access to the largest network of doctors and hospitals in the state. Number 2, the lower the premium cost, the less coverage. All plans provide catastrophic coverage, but evaluate the deductible, co-insurance, and maximum out-of-pocket costs carefully. It is the premiums and total out-of-pocket costs that matter. Just looking at premium costs is like evaluating pre-tax instead of after-tax, so pick the level of self-insurance that makes sense for you. As always, the Group Insurance Trust can be your source of information on healthcare reform. At over 20,000 pages of regulations and climbing, we can't review everything in the Affordable Care Act in this short period of time. For more complete details, please see our ebook, April 15th Will Look Like a Picnic, and the other videos in this series. Please feel free to contact us.